And welcome back to America's Retirement Headquarters, home of the Retirement Guys Formula and America's Medicare Associates with Nolan Baker, Scott Kerschner, and Chaz Price. 419-794-3030 is the phone number. That's 419-794-3030. When it comes to retirement expenses, there is one item that Americans get wrong, and that is how much they're going to spend on healthcare and medical. They told a Fidelity survey, that over a 20-year retirement, they think it's going to be around $41,000, but research shows the real estimate is $315,000. That is a huge disparity. And guys, that doesn't even include long-term care. So what is their reaction when you point out the difference, and how do you help them plan for that?
Well, their reaction is kind of like that blank expression on their face, that stare. Their eyes are real big, and they're like, what? I didn't think I was going to spend that much money in retirement and on health care. One of the big problems and misconceptions of health insurance in retirement is, I've got Medicare, it's going to cover everything. Well, that's not the case at all. First, like you mentioned, Chris, long-term care. Long-term care is not covered in Medicare. If you don't have a long-term care policy put in place, there's no coverage for that. And long-term care is a huge expense. We talk about that a lot, and we're looking to talk more about the caregivers and the stress that has on caregivers. But long-term care is not included at all in Medicare, and those could be significant. You're looking at upwards of $85,000 to $100,000 a year in long-term care costs. That's one way to blow up a retirement plan for sure, right? But so one of the things that we do, and one of the things that I do with Medicare or health benefits in retirement, is I look at a average of what are you looking to spend, right? So an average 65-year-old in retirement, if you go with a Medicare supplemental plan and you match and equal the benefits of an Advantage plan, you're going to be looking at roughly $3,500 a year. Now, if those rates don't go up, which they do, but if they didn't go up, if you're looking at $3,500 a year over a 20-year period, you're looking at roughly $70,000. That's not taking into account the Medicare Part B premium, which is another, a couple grand there as well. So you're looking an average couple of 65 years old spending $3,500 a year for a supplement with dental, vision, and hearing added in, roughly $120,000 a year each. That's $240,000 right there, and that's not taking into account the out-of-pocket expenses that you're going to pay for your prescriptions. One of the things I find is your prescription costs are very, very high. That's probably what's driving most of the Medicare expenses and costs out of pocket. So, if you're not looking, like we mentioned in a previous segment, a second opinion, I encourage you to get a second opinion. Nolan, you and I met with a client at the end of last year, and they were looking to retire, and we built a comprehensive plan, put it together so they were able to retire, but we were looking at keeping their expenses low, and they're looking at paying roughly I think it was like $2,500 a year in premium, because we were able to keep their income, reportable income, low. But that's with a $9,000 deductible. So you're looking at least $11,000, $12,000 in a spend if you have any type of catastrophic claim or anything, during retirement. So, it's a lot more expensive than a lot of people think. They really don't know, and a lot of advisors out there just don't go through that breakdown with them.
Well, it's a matter of shopping out your insurances and knowing how to navigate the system. We just did this recently with our home and auto insurance, as I've added a couple more cars to the fleet of cars that I have.
Right.
But, we were able to find a 20% savings by just looking around out there. And that's, part of the value of getting a second opinion. And I think for those of you that are listening, you need to realize if you're before the age of 65, so if you're looking at retiring before 65 and you're going to get health insurance from the Affordable Care Act, what you need to understand is it's an income, not an asset-based test, and this is exactly how we can help you out. I think of another example. Gary and Teresa, age 63 and 62, have an income goal of $70,000 a year. Their original plan was to draw money out of their retirement account, and if you looked at the gold plan on healthcare.gov, it was estimated to be about $2,279 a month. But option number 2 is what we did is we showed them how to take income from another investment source, take it out of a non-countable, not retirement account. And by doing that, the healthcare cost was lowered by $1,327 a month. So their new premium is only $952, saving them a tremendous amount of money, putting it back in their pocket. And for those of you that are over the age 65, making sure that you understand the amount of income that you get is also going to impact what your Medicare premium costs are. So if you're worried about navigating that and you want to get somebody that you can talk to, not have to call an 800 number, talk to somebody over the phone and repeat over and over again what you're looking for, but you want to get an independent financial professional's opinion on what you should do with your healthcare costs, that's exactly what I think Scott and the team at America's Medicare Associates will do when you're trying to figure out how much will healthcare cost help me in retirement. And then we take it a step further. And like what we had talked about with the group that recently came out to our event at Urban Pine Winery, is we talked about now how to then leverage your existing assets to get you some protection if in the event down the road you or your loved one needed some long-term medical care. And we were showing people how to do that without buying traditional long-term care. So a lot of great solutions, but when you think about, again, the estimates that are out there showing $315,000 is what the average retirees are going to spend over a 20-year retirement time. It can add up, and navigating that landscape is why it's a good idea to get professional guidance, I think, moving you down that path.
Once again, the value of that second opinion coming in where, if you thought you were going to be spending $41,000 and then ended up, having to actually foot the bill for 9 times that amount, that can really put your retirement in jeopardy. So just being aware of that is one thing, and then developing a strategy to work through that is the whole other thing. And it starts with that phone call, 419-794-3030, or you can also go to the website as well, arhq.com.